Okay, so let's talk about Tommy John surgery. We hear it so often in the baseball world. So what exactly is it for those of us and viewers at home that may not know?
So Tommy John surgery is a surgery that's done when a throwing athlete injures the ligament that goes from the inside part of their elbow. So basically, from the upper arm bone down to your ulna.
Okay, and pain-wise level? Can you tell immediately that this happened?
Yeah, a lot of times players will feel like a pop when it happens, although sometimes it kind of is dragged out over time. There's other injuries that are kind of associated with it, but most of the time what happens is they're out there, they're either throwing a bullpen or they're in a game, and they'll feel something kind of snap or something twinge inside there, and it's something that keeps them from continuing on.
Okay, but let's talk about the name, Tommy John. Talk to us who he was and why this surgery was named after him.
So Tommy John was a very interesting guy. He was a very successul major league pitcher. And he's a very interesting story. So he actually loved playing basketball more than he liked playing baseball.
Okay.
And then but he was a better baseball player than basketball player. And eventually what wound up happening was he was left-handed, he pitched, he got better and better and better, and I think it was 1974, he was pitching for the Dodgers,
okay.
and he had tremendous pain on the inside of his elbow. He had a number of injections over the course of many years. If you look at his X-rays, actually very impressive with the amount of bone that had formed in there. And there is a now very famous orthopedic surgeon out there. Part of his institute's named after him. His name's Frank Jobe. And he had been thinking about a surgery that could be done to repair that ligament, because for a long time, doctors didn't even really recognize that as a possible injury for baseball players.
Really?
Yeah, it's kind of funny. So if you read like old orthopedic literature, it doesn't even shows us up as something that's really, really rare.